Hello and welcome to Medis Academy. This is Dr. Godfrey Mombi. Today we are looking at antibiotics and we're going to look at a very simplified way of remembering all classes of antibiotics. First things first, let's define what antibiotics are. So by definition, antibiotics are compounds or chemical substances that are produced by microorganisms, or they can also be synthesized artificially, but they inhibit the growth of bacteria or they can kill bacteria while causing minimal harm to the host. If they cause death to the bacteria, we call them bactericidal, and if they only inhibit growth, we call them bacteriostatic antibiotics. Okay, now that we know what they are, let's look at the mnemonic. So the mnemonic goes like this. The quick and good students always carry a case of pens, markers, maps, rulers, and notebooks. Simple and easy to remember. The quick and good students always carry a case of pens, markers, maps, rulers, and notebooks. Let's break it down. When you look at classes of antibiotics, you find tetracyclines, quinolones, or fluoroquinolones, glycopeptides, sulfonamides, aminoglycoside, cephalosporins, carbapenems, penicillins, macrolides, monobactams, rifamycins, and nitroimidazoles. You can see how the mnemonic corresponds to this. The quick and good students always carry a case of pens, markers, maps, rulers, and notebooks. The for tetracyclines, quick, that's Q for quinolones / fluoroquinolones. And the difference here is very simple. Fluoroquinolones are just quinolones that have a fluorine atom added to them. Good, that's glycopeptides. Students, that's sulfonamides. Always, that's aminoglycosides. Carry, that's cephalosporins. Case, that's carbapenems. Pens, penicillins. Markers, macrolides. Maps, monobactams. Rulers, rifamycins. Notebooks, nitroimidazoles. Okay, let's now look at examples of these classes and what type of bacteria they work against. Tetracyclines will work against both gram-positive and gram-negative bacteria, and examples would be doxycycline, minocycline, and tetracycline. Quinolones will act both against gram-positive and gram-negative bacteria, and then we have ciprofloxacin and levofloxacin as examples. Glycopeptides will work against gram-positive bacteria, and then we have vancomycin, teicoplanin, and delbavancin as examples. Sulfonamides will be active against gram-positive and gram-negative bacteria, and then we will have sulfamethoxazole, sulfadiazine, and sulfasalazine as examples. When we get to aminoglycosides, we will have them acting against gram-positive and gram-negative bacteria. And then examples will include gentamicin, amikacin, and tobramycin. Cephalosporins will act mostly against gram-negative. And then examples will be cefazolin, cefacla, and ceftriaxone. Carbapenems are working against both gram-positive and gram-negative bacteria. Then examples include meropenem, imipenem, and doripenem. Penicillins, both against gram-positive and gram-negative. Then examples include penicillin G, penicillin V, and amoxicillin. Macrolides working against gram-positive, and then examples include azithromycin, clarithromycin, and erythromycin. Monobactams working against gram-negative, and then we have aztreonam as the only example here. And then we have rifamycins, which work against both gram-positive and gram-negative bacteria. And then examples include rifampicin, which can also be called rifampin, and rifapentin. These are TB drugs. Then we have nitroimidazoles. These work against both gram-positive and gram-negative bacteria. And examples will include metronidazole, tinidazole, and nimorazole. Okay, this is quite simple, very easy and straightforward. But let's now look at their mechanisms of action. Okay, when we look at tetracyclines, these will inhibit protein synthesis by binding to the 30S ribosomal subunit. The next class is that of quinolones. These will inhibit DNA gyrase and topoisomerase 4, and this prevents DNA replication. The next class is that of glycopeptides. These will inhibit cell synthesis by binding to the dealanine portion of peptidoglycan precursors. And then we have sulfonamides. These will inhibit dihydropteroate synthesis. This prevents folic acid synthesis and causes inhibition in the growth of the cell. And then we have aminoglycosides. These inhibit protein synthesis by binding to the 30S ribosomal subunit, and this causes mRNA misreading. Then we have cephalosporins, which work by inhibiting cell wall synthesis, and this is done by binding to penicillin binding proteins. We move on to carbapenems. These will inhibit cell wall synthesis by binding to penicillin binding proteins. We also have penicillins. They are also inhibiting cell wall synthesis by binding to penicillin binding proteins. The next class is that of macrolides. These will inhibit protein synthesis, this time not by binding to a 30S ribosomal subunit, but these are binding to the 50S ribosomal subunit. Then we have monobactams. Monobactams inhibit cell wall synthesis by binding to penicillin binding proteins. And if you've paid attention, then you've noticed that penicillins, cephalosporins, carbapenems, and monobactams all share the same mechanism of action. They all bind to penicillin binding proteins. What this does is it inhibits peptidoglycan cross-linking, which weakens the bacterial cell wall and leads to cell lysis. This is how they cause damage to the bacteria. And together, these are called beta-lactam antibiotics. The next class is that of rifamycins, the TB drugs. And these are going to inhibit RNA polymerase, which prevents RNA synthesis. And then we end with nitroimidazoles, where metronidazole is the main example. These will cause DNA damage through the reduction of the prodrug to an active form that binds to DNA. So this is a simple way of remembering all classes of antibiotics, how they work, and the main examples from each class. Thank you for watching. See you in the next one. Don't forget to like, share, and subscribe.